Ever wondered what a yeast infection really is? It's a common question with an answer that may surprise you. A yeast infection, also known as candidiasis, is a type of fungal infection. The primary culprit is a group of yeasts called Candida. While Candida is usually harmless, problems arise when it overgrows and causes infection. Now, when you hear the term yeast infection, you may immediately think of women's health. It's true that vaginal yeast infections are common, but it's important to note that yeast infections aren't exclusive to women. They can affect anyone, regardless of gender or age. They're also not confined to one specific area of the body. Yeast infections can occur in the mouth, throat, skin, and even the bloodstream. So, yeast infections are more than what you might initially think. They're complex, diverse, and quite common. Now that we have a basic understanding of yeast infections, let's dive deeper into its symptoms. How can you tell if you or someone else has a yeast infection? You might be wondering. Let's unmask the 5 common symptoms. Firstly, itching and irritation are often the initial telltale signs. This isn't a mild annoyance, it's a persistent itch that demands attention and can become extremely uncomfortable. Next, redness and swelling of the affected area are common. This can occur anywhere on the body, but is particularly noticeable when the infection is in visible areas like the skin or mouth. Thirdly, pain during urination or sexual intercourse can indicate a yeast infection. The discomfort can range from a slight sting to a sharp, burning sensation, making these activities highly unpleasant. The 4th symptom to watch out for is unusual discharge. This can manifest as a white, clumpy substance similar to cottage cheese, or a watery, milky discharge, depending on the type of yeast infection. Lastly, soreness or rash in the infected area is a common symptom. This can make daily activities challenging and can lead to further complications if not addressed promptly. Remember, symptoms can vary depending on the infected area. For instance, oral thrush, a type of yeast infection in the mouth, may present with white patches on the tongue or inner cheeks, while a skin yeast infection may cause a noticeable rash. Identifying these symptoms can lead to early detection, but what causes yeast infections in the first place? Stay tuned as we delve into the causes in the next segment. So, what triggers these pesky yeast infections? Well, there are several factors that can disrupt the balance of yeast in the body and lead to an infection. Let's dive into 5 of the most common causes. Firstly, antibiotic use can often be a culprit. While antibiotics are fantastic at knocking out bacteria causing an illness, they can also wipe out the beneficial bacteria that keep yeast levels in check. Secondly, a weakened immune system can make you more susceptible to yeast infections. This is because your body may not be able to effectively keep yeast growth under control. Thirdly, uncontrolled diabetes can also be a cause. High blood sugar levels can create an environment where yeast thrive, leading to an overgrowth and subsequent infection. Fourthly, hormonal imbalance, especially seen in women during pregnancy, menstruation, or while on birth control pills, can upset the balance of microorganisms in the body, including yeast. Lastly, poor hygiene can also contribute to yeast infections. This is because yeast thrive in warm, moist environments. Hence, not drying yourself properly or wearing tight, non-breathable clothing can create the perfect breeding ground for yeast. Each of these causes can individually or collectively disrupt the delicate balance of yeast in the body, leading to an overgrowth and infection. Knowing these causes is crucial, but it's just as important to understand potential complications. What happens if a yeast infection is left untreated? This question may hover around your mind if you or someone you know is dealing with a yeast infection. The answer, unfortunately, is not as simple as one might hope. One of the key complications that can arise from untreated yeast infections is the recurrence of the infection itself. This is a situation where the infection comes back repeatedly, making it a chronic issue that can significantly impact a person's quality of life. The second potential complication is the spread of the infection. Yeast infections, if not treated promptly, can spread to other areas of the body, causing discomfort and other symptoms in those areas. Skin cracking and sores are another complication that can arise. The constant itching and discomfort can lead to the skin around the infection becoming cracked and sore, which can be painful and increase the risk of further infections. The 4th complication to consider is the increased risk of other sexually transmitted infections. Yeast infections can cause inflammation and changes in the vaginal environment that may make it easier for you to contract other STIs. Lastly, in very rare cases, the yeast causing the infection can enter the bloodstream, leading to a serious condition known as invasive candidiasis. This can cause symptoms throughout the body and requires immediate medical attention. Though these complications sound worrisome, yeast infections are preventable. So, it's essential to recognize the signs and seek treatment promptly to avoid these potential complications. How can we keep yeast infections at bay? Let's delve into 5 ways to prevent this common yet bothersome condition. Firstly, maintaining good hygiene is paramount. Regularly cleaning the genital area with mild, unscented soap and water helps keep the environment unfavorable for yeast overgrowth. Remember though, overzealous washing can disrupt the natural balance of microbes, so moderation is key. Secondly, avoid practices such as douching. This act of washing out the vagina with water or other mixtures can upset the delicate balance of bacteria and yeast, making you more susceptible to infections. The third tip is to wear breathable underwear, preferably cotton. Yeast thrives in warm, moist environments, so it's beneficial to keep the area cool and dry. Tight clothing and synthetic fabrics can trap heat and moisture, providing an ideal breeding ground for yeast. Fourthly, managing conditions like diabetes is crucial. High blood sugar levels can create a conducive environment for yeast to flourish. Regular monitoring and control of blood sugar levels can help prevent yeast infections. Lastly, avoid unnecessary antibiotics. These medications can kill off the beneficial bacteria that keep yeast in check, leading to an overgrowth. Always consult a healthcare professional before starting a course of antibiotics. Prevention is key, but if you do get a yeast infection, there are effective treatments available. Prevention not only keeps you comfortable, but also saves you time and resources spent on treatment. So, let's take these steps towards a healthier, yeast infection-free life. So you've got a yeast infection, now what? First off, it's important to remember there's no need to panic. Yeast infections are common and luckily, they're also treatable. Let's dive into 5 common treatment options. First up, antifungal creams. These are topically applied directly to the affected area and work by killing the yeast that's causing the infection. They're readily available and often the first line of defense. Next, we have antifungal ointments. Similar to creams, these are also applied directly to the infection. The difference lies in their composition. Ointments are generally oil-based, which can help them stick to the skin longer and provide extended relief. Thirdly, antifungal tablets. These are inserted into the vagina using a special applicator. They dissolve over time, releasing medication that kills the yeast. This can be a good option for those who find topical treatments messy or inconvenient. The fourth option is oral medication. This is usually reserved for more severe or recurrent infections. The most commonly prescribed oral antifungal is fluconazole, which works systemically to stop the growth of yeast. Finally, we have probiotics. These are beneficial bacteria that can help restore the natural balance of microorganisms in your body. There's ongoing research about the effectiveness of probiotics in treating yeast infections, but they may be a helpful addition to your treatment plan. Now, it's crucial to emphasize this. Always consult a healthcare provider before starting any treatment. They can confirm whether you truly have a yeast infection and guide you in choosing the best treatment for your specific situation. Remember, each person is unique and what works well for one might not be the best for another. Moreover, if your symptoms persist despite treatment, or if they recur frequently, it's important to see a healthcare provider. In some cases, persistent or recurrent yeast infections might indicate an underlying health issue that needs to be addressed. Armed with this information, we can tackle yeast infections